Hi, my name is Ian Khan, and you're listening to the Innovation Times podcast. I am a technology author, speaker, and an advocate for everything good that technology brings. A part of my work is running the Innovation Times podcast and bringing together people from various aspects of the industry and talk about how technology is affecting the way that they perform their jobs, their functions, and how they're leading their organizations through change that's propelled by technology. As part of my podcast, I interview people from all segments of the industry and different verticals as well. Welcome to Innovation Times.
Hi, this is Ian Khan from Innovation Times, and today I have a very exciting guest here on our podcast. Dr. Joseph Kvedar is the Director of Center of Connected Health at Partners Healthcare. He's an innovator and a leader in the field of telehealth, and we're so glad to have him on board today. Dr. Kvedar, welcome to the show.
I'm delighted to be with you.
Now, you are really a pioneer when it comes to telemedicine, when it comes to connected health. And really, there's a tremendous amount of work and initiatives that you're part of today, and really driving change within the industry. You also have a lot of publications to your name. You also have a new book that I'd love to ask you a little bit about. But tell us what's your journey been of connected health in the past few decades of your work. How have you seen the industry move from being at its infancy to being where it is right now with all the emerging technologies that are really changing the landscape?
Well, again, it's great to be with you today and talk about these fascinating and exciting developments. I am a dermatologist by training. I trained here in the Harvard system in the mid-'80s, and then at that time was interested in laboratory science. So I spent the first 5 years after my residency in a laboratory, and then in the early 90s, say 92, 93, I had a bit of a career crisis and decided I wanted to do something else. And while I was searching for other things to do, I really stumbled into a project where we were looking at the utility of digital images in dermatology, which at the time was very much cutting-edge thinking. And lo and behold, one day it just occurred to me that we were missing a whole different way of providing care and a new care model, which meant that we shouldn't have to insist that for you to get health care, you have to come to a physical space, meet a doctor in person. Was the only care delivery model we had at the time, and I thought that seemed very silly, that we should be doing things in a time and place independent manner. And I've never really looked back after that. Of course, we're still pursuing that dream. I'd say if we look at it very objectively, less than 1% of care across the world is probably delivered in this way, so we have a long ways to go. Not, of course, that we ever want to hit 100%, but we want to get somewhere where, like other industries, that there's a robust set of services delivered in a routine manner for healthcare that's done time and place independent. Along the way, absolutely, you're right that the technologies have made it easier and easier and easier for us. In the beginning, the reason that digital imaging was considered cutting edge was because the images we captured were less than 1 megapixel. The camera cost $12,000. We had these little optical discs to store them on. We didn't have hard drives bigger than 130 megabytes, et cetera, et cetera. And for video conferencing in those days, we would string 3 special phone lines, ISDN for those who don't remember that term, and $60,000 codecs on each side. So the world has gotten amazingly better. Now in the palm of your hand, you have video, you have image capture, you have the network, you have the computing, et cetera, and all for the cost of your smartphone. So technology keeps marching on, and healthcare delivery keeps playing catch up, and that's the fun game that we're in.
amazing. Now, you mentioned the older phone systems, and I still remember the times of the BBC Micro and those 5.5-inch floppy disks that we used to have, and really, if you look at it, the last 20 years plus, have been a remarkable time, and we are in that age and time where change and innovation and technology is just growing in such a, I wouldn't say at a fast pace, but at such an incredible pace of being able to create value. And we're able to do so much more. The children of today have supercomputers in their hands. Imagine what they will have 20 years from now or even 10 years from now. So that really boggles my mind. You mentioned 1% of care across the world is probably being offered through remote medicine, telemedicine. Now, for communities that are underprivileged, that do not have access to resources, this should tremendously impact the way they get even basic health care.
Yes, and I think for excluding the developing world where it's very much a patchwork, but in the U.S. and Canada, I would say rural communities have disproportionately adopted telehealth because for the reason you mentioned, that the availability of super specialized healthcare, which exists in urban areas, did not exist in those areas. And there are a number of politicians in both countries over the last 20 years who have felt strongly that their constituents should have access to high-quality care wherever their geography is. Now, I happened to read in the Wall Street Journal this morning about pockets in the U.S. that are still on dial-up for their internet access. So it's certainly not universal, and I don't mean to imply that, but there's been a lot of effort in the U.S., and I know Canada is actually, I think, ahead of us on this in the past 20 years to create rural networks of care using telehealth. So I see a lot of excitement around that, and I think that's a perfect place to start. I also know that there's plenty of urban applications, and we're not fully realizing those yet. So there's also plenty of room to grow.
Now you talk about three trends, and you talk about personalized medicine, you talk about connected health, and payment reform. Tell us a little bit more about how we tie in payment reform to medicine and connected health.
Well, in the U.S., and that's my main perspective, but I think this can be extended to one of the reasons I think, for instance, Canada is ahead is because there's a centralized mechanism for both deciding payment structures and dispensing payment. But in any case, the older notion that the way you should pay a healthcare provider, be it a hospital or a doctor, is through services rendered. It seems to really be falling by the wayside. That because what that does, and we've all witnessed it, and it's pretty mainstream thinking now. What that does is it extends, or rather, it encourages the healthcare provider to do more, because they get paid when they do something, so they want to do more. It's human nature that we all want to make a living, and organizations go that way. The newer payment models are based on outcomes and quality, and in those payment models, you get paid not necessarily for doing more, but doing the right thing for the right patient. So that enables us to get excited about data analytics that help us to find the right patients that need our help the most. It enables us to think about virtual care because that can be more efficient. So why would I ask you to come into the office to check your blood pressure every 3 months, and we can measure it 3 or 4 times a week in your home remotely, and you don't need to come to the office at all if I know you're doing well? In a fee-for-service world, why would I do that? Because coming to the office allows me to ring the cash register, whereas in a value-based payment world, keeping you healthy at home allows me to ring the same cash register. So there's a tremendous opportunity as we move to these value-based payment schemes to utilize both telehealth and remote monitoring and patient engagement and apps and all of those digital health tools, because they enable us to spread our healthcare providers across more consumers, more patients, which is how providers will end up being financially successful in this new world. So it's a tremendous way of increasing adoption of connected health. And we've seen it in our own system here in Boston, where doctors that for years were very skeptical of any of these care delivery mechanisms have been much more open to them as we changed from a fee-for-service to a value-based way of thinking.
I was at a healthcare conference just last week with insurance providers, and the topic of discussion, rightly as you said, is there's a lot of interest on how do you change the lifestyle of your now they are consumers, the healthcare consumers, in order to have those different outcomes, and this the fee for service model is definitely something in light of Medicaid, Medicare, Obamacare. There's just a lot of legislative changes that have taken place generally over the past few years in the United States. So I can tell from my experiences last week that insurance providers are looking at newer models. They want more stability in their businesses in order to cater to that demand over a long period of time, rather than feel the shocks of every small change in legislation that they see with a new government. Now, the Internet of Things is so interesting, and your book, the Internet of Health, the Internet of Healthy Things, is an exciting take, and I love the title. Is so exciting in the time of connectivity, in the time of wearables, where we all are potentially can wear these devices on our hands and measure our blood heart rates, and we can wear shoes that'll send those that information to a central system. How does all that tie together? How do you see the future of healthy things? How can we interact with that?
Well, I take a lot of lessons learned from the retail industry and how they have used Internet of Things applications to change our lives. When I published the book, Internet of Things was kind of a new topic, so we got a lot of traction early on because of that. We still get robust pickup of the book, but things have changed in a year in such dramatic ways already. And for instance, the Amazon Echo was not a living room or kitchen appliance when I published, and now that is. So everyone understands fundamentally what an IoT application is. The Nest thermostat is another one that was just starting to get traction when we published. People now understand that you can put a thermostat in your home that communicates with the internet, that communicates with weather, that learns from your behavior, and those are all IoT phenomena. So that makes it fun to talk about how our health might change. And if you can imagine all of the data that you generate on a daily basis, either just through your use of your mobile device, or if you're in the wearables space collecting things like activity or weight or blood pressure or sleep habits or what have you, all of those data can be used to create a unique profile of you. And that's the value that the things bring. They bring value in two ways, the connected things and the Internet of Things. One is the feedback loops that they generate help keep your health behaviors top of mind. If you hadn't thought about your activity level much, and then you start to measure it using a wearable, you learn very quickly, usually because most of us are sedentary, how inactive you are, and maybe you want to change that. And I like to say that the sensors component of this is really about helping our bodies with the things that we evolved not to feel, whether it be high blood pressure or inactivity or blood sugar. Any of those we can now assess using sensors that somehow that's how we evolved. If high blood pressure was like a broken arm, we'd have a completely different conversation. So there's all the data coming in, and then there's a middle layer of analytics that take it all and normalize it and make sense of it so that we can create that unique profile of you at a point in time and at a point in your life. We know not just your physiologic data, but there's companies out there that can now do based on voice tone. They can predict your mood. There's companies that can do facial recognition and predict things about you. There's incredible applications of anything coming off of your person or off of your phone can be turned back into a stream of data that we can use to predict your health. And of course, not to ignore all the genetic information that's coming out of that world as well. And then finally, using that unique persona of you in the moment at time to become a fulcrum for engagement, for inspiring you to change your health, using those same feedback loops and giving you constant messaging and ways of keeping connected that are motivating to you and personalized to you in order for you to take charge of your own health and move your own health forward. That's the vision, and we're starting to see bits of it come up in the industry. I mentioned some of the aspects of the things. Companies like United Health Group now rewarding individuals for walking certain, they have an activity program where they measure 4 different kinds of activity, and you can earn up to $4 a day in your health savings account if you achieve those goals. So there's really a lot of interesting innovation going on around how we use IoT to improve care.
That's amazing. And the more you think about it, there's so many questions that arise out of this. There's the confusion about big data and what does the big data do. But from a consumer point of view, the question that arises is, okay, are computers taking over my life, and is my information going to be all over the internet? I think there's a lot of confusion still, not just around telemedicine or this, that, or the healthcare side of things, but overall the technology. And I think there's a genuine right for everybody to know what their privileges are, what their rights are with their information, being passed on from provider to caretakers and so on and so forth. How would you recommend that anybody who wants to get started with this, with making technology a part of their lifestyle, so that they can have more value out of it, and not replace good habits with just technology and hope the wearable can make you run faster? But I think they also need to make that effort to have a conscious and healthy lifestyle. How would you recommend that an average person get started with this revolution of the Internet of Things, wearables, and using technology to enhance their lifestyle? Should they buy a wrist, a Fitbit or something like that? How can we get started?
Well, I think so. It depends on what motivates you. The way to start is to introspect on what motivates you. I'll tell you another story. As I mentioned, I'm a dermatologist. I still see patients a half day a week, enjoy it tremendously. And as a dermatologist, I see a lot of healthy individuals, and a number of them have these things dangling from their wrists. So I can't help, because of the other part of my life, I can't help but ask them about them. And almost every single one of them is in a competition with a loved one or somewhere at work or something. So that's just an interesting point. I think what I wouldn't recommend is to buy the Fitbit if you're not self-motivated to be more active, because it will wind up in the drawer. But if you have a spouse or a family member or a companion at work and you want to do a competition, that's a great way to get started, because there's that little extra motivation that most people find of wanting to win. There are websites for others, people who are more introspective or don't really want to compete. There are websites you can sign up to, for instance, where you can track activity and donate to charities based on your achievements. And some people like that. Walgreens will let you hook your app to your wearable to their app, and they will give you in-store credit for being more active. So if you like the idea of achieving discounts at a place like Walgreens, you can do that. You really have to first think about what is going to motivate you to be more active, and then plug the tracker into that scenario rather than just get the tracker and then again it winds up in the drawer in a few weeks because there's no motivational overlay to the program.
That's an excellent point, and I wear a Fitbit. I have some technology around my house. I have the Nest thermostat and a few other things. These things definitely make life easier. You get more access to information, but you also become lazy. And I think it's about how you use technology to do what and what results you want in the end. But you know what? I think there's no alternative to having good habits, having a healthy lifestyle that promotes health overall. And then you can definitely use technology to change things. I know we're short on time, and we're just going to conclude the interview here now, as we're running out of time. Last words of advice, given the change of the revolution to IoT, artificial intelligence, blockchain technology. There's just way too much going on. What direction should we invest in terms of finding the next piece of innovation? What technology do you think has the maximum potential of succeeding, or what combination of technologies do you think should we keep an eye on for the next few years?
So I give you two examples. You're right. I for instance don't know enough about blockchain to render a judgment on that. But I would say the class of wearables that's coming through that gives insights rather than just a number is very interesting. Companies like Spire, Muse, others, they're measuring something that's quite boring, but what they report out to you is an insight. I think that's an interesting trend. And then the artificial intelligence, although it's so trendy to say artificial intelligence, we used to say big data, then we said machine learning, now we say AI. It's kind of all the same. But the evolution in that space is really important, and it is and will do everything as promised. So I would say get over the fear that it's going to be a sinister implementation. We'll always have and need human beings. We're not going to be like the film Ex Machina or Blade Runner. And the flip side is artificial intelligence can do already today most of what we as human beings do poorly can do very well for us and free us up to do the things that we as humans can do better. In the case of my job, artificial intelligence should free me up to take care of you, with emphasis on the term care, as opposed to type into a screen instead of looking at you when you're in the office, or spend my time worrying about whether I remember the drug interactions. All that should go on in the background, which should enable me to interact with you in a very human way to help you move your health in the right direction.
Dr. Kvedar, it's been wonderful chatting with you. Where can our listeners find more information about you, your work, your book? Is there a URL or a website?
Well, we have probably the easiest one is the Internet of Healthy Things, all spelled out, the internetofhealthythings.com. That has links to the book, that has links to our Connected Health website, has links to my blog, which is the other thing to search is C Health Blog, CHELTH, C Health Blog. Will get you to my blog, which has links to everything as well.
That's been an amazing conversation here with Dr. Joseph Kvedar. Dr. Kvedar, thank you so much for giving us these insights, and we hope to chat with you soon and learn more about some of the exciting things that you're working on. Thank you so much.
Thank you for the time.
If you're confused about the current state of technology and the impact that it has on the world, then you are at the right place. My name is Ian Khan. I'm an author and a technology speaker who focuses on the value created in the current world. I talk about ideas, thoughts, and value creation in general that helps us propel ourselves into a future that's driven by technology. The Internet of Things, blockchain, artificial intelligence, cloud, are all means to create value. Technology, in general, is an enabler for positive business outcomes. If you're confused about the outcomes that technology can create for you, then you're at the right place. For more information, you can always visit me on my website at www.iankhan.com or follow me on social media, on Twitter at IanKhanLive. Let's change the future by creating a value, nothing else. Let's just change the future by creating more value. That's what I stand for, and that's my message.
When you fall